The name is Leukamoid reaction. Focus at the two parts of this term, OID, and the leukemia plus OID is equal to leukamoid and reaction. The first thing, leukemia plus OID. OID means resembling something, mimicking something, but not exactly the same thing. It basically tells you that this is a non-neoplastic condition which actually resembles a neoplastic condition, leukemia, but actually it's not leukemia. It feels like leukemia, smells like leukemia, appears like leukemia, particularly on the peripheral blood smear, because due to the high WBC count which is noted on the peripheral blood smear with some immature form seen. But actually it is not leukemia, particularly it is confused with CML, it is not CML. And secondly, another term is there at the end which is called reaction. Reaction basically means you that it actually occurs due to a reactionary measure. Reactionary measures particularly due to some infection, sometimes due to drugs also. Particularly due to some bacterial infection, what happens? There is a sudden abrupt rise in the WBC count, and it is seen on the peripheral blood smear or the total blood count, and apparently it looks like a leukemia, particularly confused with CML, chronic myeloid leukemia. That's why this condition is given as the name leukamoid reaction. But actually it has nothing to do with the leukemia, because leukemia, we all know, is a neoplastic condition which is arising from the bone marrow, and it is basically neoplastic proliferation of the hematopoietic precursor cells. This is the basic difference. So first is that leukemia is a neoplastic condition, leukamoid reaction is a non-neoplastic condition. And also at the end YD, it tells you if anything, something ends with YD in the medicine, it basically means resembling that. Let's say epithelioid cell. It actually means it's not truly epithelial cell, but looks like epithelial cell, which we see in the granulomas. Epithelioid cell basically are macrophages. Metalloid, actually it's not truly metal, it looks like metal, like bismuth antimony. Android operating system, which is actually Google's operating system, which acts like human but actually not human. So this whenever something is ending with YD, it basically means actually it is not that but resembling that. That is the basic idea that you need to understand at the beginning. Now let's focus on other differences. There are so many differences. CML, what would be happening, that total WBC count would be very, very high, often more than 100,000, but you would not get so high WBC count in 6 digits in the leukamoid reaction. In the leukamoid reaction, the rise in the WBC count would be transient, and if you treat them with antibiotics, because mostly it is caused due to infection, again the WBC count come back into the normal range. Obviously treatment with antibiotics would not do the same thing in the CML. The WBC count would not come back in the normal range if you are treated by antibiotics. Next thing, CML would present with massive splenomegaly, big size. It's a chronic condition, chronic myeloid leukemia, so the history would be long period. Here the history would be much shorter, usually some infection, some stress, can be due to some drug intake also. But CML, the history would be usually longer. Next thing is that on the peripheral blood smear, you will be getting basophilia in the CML, increase in the basophil. You will not get such things in the leukamoid reaction. But both in leukamoid reaction and CML, what you will be seeing, presence of immature cells, because you know how the neutrophils grow. Neutrophils grow in this way, that there is a myeloblast, then there's a promyelocyte, then there's a myelocyte, then there's a metamyelocyte band for mature neutrophil. So both the cases, what you can see, immature form of granulocytes can be seen on the peripheral blood smear. That is one of the aspects. But what would happen, the other differences is this, that basophilia, this is usually not seen on the leukamoid reaction. Myeloid bulge, another condition which I described in the CML, will be not seen in the leukamoid reaction. Then another test is usually done called NAP score or lab score. This NAP score or lab score is usually low in the case of CML, particularly in the chronic phase, but usually high in the leukamoid reaction. And diagnostically, if you do the BCR-ABL1 gene detection, or if you look for the Philadelphia chromosome, presence of translocation 9022 in the karyogram, these findings will only be seen in the CML, not would be seen in the leukamoid reaction. So these are the lot of differences are there you can create actually, obviously, but these are the key differences between the CML and the leukamoid reaction. Thank you so much.